morning and welcome to the American Society for Microbiology's annual meeting, ASM Microbe, from Boston, Massachusetts. Today we have with us Drs. Kazue Fujita and Hiroyuki Takoi from the Nippon Medical School in Tokyo, Japan. Joining them is Dr. Sae Otani, who's getting her master's course at the Bunkyo Gakuin University, also from Tokyo, and their translator, Dr. Kazue Fujita. They're right here, and they'll be presenting their research, which is titled, Contaminated Gloves Contribute to Cross-Transmission of Healthcare-Associated Pathogens Among Healthcare Workers. This research is embargoed till Sunday, June 19th at 5 p.m., and I'll turn it over to them.
Thank you, Aliyah. Good morning, everybody. Thank you for coming today. So my name is Kazue Fujita from Nippon Medical School, and next to me, Sae Otani. She is a master course student of Bunkyo Gakuin University. And next to her, Dr. Hiroyuki Takoi. He's from Nippon Medical School, and he works as a medical doctor. And last one, Dr. Fujitani. He supports us in English and organized this discussion. So we'd like to talk about healthcare-associated infection, and we'd like to share the knowledge and talk with a good discussion. And I hope you enjoy this discussion. Okay, so start with the first 10 minutes. I summarized our research, and after 20 or 30 minutes, take a question and comments and discussion. Okay? So it's my great pleasure for us to present our research. Okay, so we already prepared the handout. If you haven't handout, please raise your hands. All right? It's okay? Okay, thank you very much. Okay, so today's our topic is contaminated gloves contribute to cross-transmission of healthcare-associated pathogens amongst healthcare workers. As you know, infection control is priority for all hospitals to reduce the spread of healthcare-associated infection. Gloving is recommended as a barrier protection for healthcare workers to reduce the risk of contamination during contact with infectious sputum, urine, and body fluids. The failure to change to remove contaminated gloves carries a high risk of microorganism transmission. So we call the gloves the second skin. So it's very important for the infection control. But sometimes the gloves are used inappropriately. So we have a big data for the misuse of gloves. And one critical aspect of cross-transmission of microorganisms among healthcare workers is the ability of microorganisms to transmit and survive on the hospital surfaces. So we focus on these important pathogens for the healthcare-associated infections. We call the bad bags. And classically, we call the escape, and CCC. And classically, escape ESKAPE is Enterococcus faecium and Staph aureus and Klebsiella species and Acinetobacter baumannii and Pseudomonas aeruginosa and Enterobacter. But in recent days, K replacement to the C, so Clostridium difficile, is important pathogen of the healthcare-associated infection. And last spring, so CID proposed the add plus CCC strategy, the carbapenemase producing Enterobacteria and Clostridium difficile and Candida species. I think fungus is the most one of the important pathogens for the compromised host. And we focus on these pathogens, and today we present the gram-negative bacilli, E. coli, and Klebsiella species, and Acinetobacter baumannii, and Pseudomonas aeruginosa. Because we imagine and we have a question, which bacteria is more risk to transfer? And so we can think about E. coli to transfer the environment or not. So it's not so many study about this compete the head-to-head study among these pathogens. We try to solve these questions. And how many bacteria transfer to our gloves to the environment? So it's important. We have many clinical studies, but no experimentally data. So we focus on the two main focus of this study. So one is how many bacteria would transmit from contaminated gloves to the hospital surfaces. And next one, which types of bacteria affect cross-transmission rates among the contaminated gloves and the hospital surfaces. And today we focus on the setting. So because there are many situations to transfer the bacteria in the hospital, we called 5 moments for hygiene. Moment 1 is before patient contact. Moment 2 is before an aseptic task. And moment 3, after blood, body fluids exposure. And moment 4, after patient contact. And moment 5 is after contact with patient surroundings. So we focus on moments 3, 4, 5 because it's important phase for us. And so we try to 8 pathogens, and this is a common healthcare associated pathogens. So E. coli and Kleb and Acinetobacter and Pseudomonas, and we try to check the antibiotic susceptibility is effect of the transfer. So we choose 4 drug-resistant strains, ESBL producing E. coli and ESBL producing Klebsiella pneumoniae, and multi-drug resistant Acinetobacter baumannii, and last one is MDR Pseudomonas. And all of them are ATCC strain or clinical isolated and environment. So next shows you our result. So in this graph, we show the all results at a glance. So all tested microorganisms transmitted from the gloves to the polypropylene surface and decrease time dependently. So you can see the graph on left-sided. So 0 minutes after inoculation gloves. So we try to drop the bacterial suspension on the gloves and immediately touch to the surface. And after 3 minutes, so its glove surface dried completely. After 3 minutes, we try to touch the surface. We compare to the wet condition and dry condition. So in 0 minutes after inoculation of gloves, it's wet condition. All tested microorganisms transfer to the environment. But interestingly, 3 minutes after the inoculation of gloves, so glove surface dried completely, only Acinetobacter remained on the surface. It's a big data for us. And next, how about the resistant pathogen? So it's similar to the keep the susceptible pathogen. So all tested microorganisms transmitted from the gloves to the polypropylene surface and decrease time dependently. But similar to the susceptible strains, Acinetobacter, multi-drug resistant Acinetobacter remained on the surface. So Acinetobacter easy to transmit and survive on the gloves. It's very interesting. So next, we focus on the 3 minutes after the inoculation gloves. So you can see the E. coli and Klebsiella and Pseudomonas is not transfer and not survive on the gloves as the environment, but only Acinetobacter is transmitted to the gloves, and after that, after transmitted on the surface of polypropylene, we can see the 100 bacteria on the environment. And how about the resistant pathogen? MDR Acinetobacter remained on the polypropylene surface 3 minutes after inoculation grafts. So 3 minutes means the graft surface is completely dried. So MDR Acinetobacter transmitted and survived on the graft after 3 minutes and transfer a little bit over 50 bacteria, number of bacteria is survive on the polypropylene. It's a very little amount of bacteria, but it's important because we cannot see the surface on the bacterial fluid, but to transfer and remain. So I don't care how long I survive on the environment in this study, but previous data have a long time survive. Acinetobacter can long survive and over 9 days. So it's important result for us and all of the healthcare-associated infections researchers. So move on to the discussion. So Acinetobacter are high risk of transmission from the gloves to the hospital surfaces. Our study shows Acinetobacter appears to be more easily transmitted than E. coli, Klebsiella pneumoniae, and Pseudomonas aeruginosa. And this ease of transmission may help explain the emergence of MDR Acinetobacter because there are many data in the clinical, many data and study clinical settings. The previous data shows gowns, gloves, and unwashed hands of healthcare workers were frequently contaminated with MDR Acinetobacter. And next one, Acinetobacter can survive in desiccated surfaces for the prolonged periods of time. So our results suggest that these clinical settings study is similar to the clinical setting study and our experimental studies. So this means how to management to infection control. So because it's best to care all of the pathogen in the hospital, but it's impossible because we are very busy and sometimes we can't care all of them. But if this data is correct, we can only care of the few pathogens. So we Acinetobacter is care strictly in the hospital settings, and MDR and suspected Acinetobacter is equal to transmitted, so we have to care the same susceptible pathogen and resistant pathogens. So it's useful data for the save money and time and labor in hospital settings. So in conclusions, contaminated glove contribute to transmission of healthcare-associated pathogens among healthcare workers. Acinetobacter are high risk of transmission from the gloves to the hospital surfaces. Improvement glove use compliance with decrease the risk of healthcare-associated infections. It is also important to establish a basis for a risk assessment and management approach to each bacteria. Thank you for your attention. So we'd like to take a question and comments and any advice. But I'm sorry, we are not native English speaker. So some situations, you give a question and he translated and we answered your question in Japanese. Okay.
Thank you for, hi, I'm Michael Schmidt from This Week in Microbiology as well as the Medical University of South Carolina. Thank you for this very significant study. This is a very important area. My question is, what proportion of healthcare-associated infections do you estimate is likely contributing from the glove error? Is it half of the infections that you are seeing in your hospital, or is it far fewer? And what fraction, the second question then, is what fraction of the healthcare associated infections that you see in your hospital do you believe are a consequence of hand hygiene failures? Thank you.
Okay. So how about you? Okay.
No.
Okay. So you mean the which bacteria is important, and how about manage in the hospital? Your
No,
question
just
is-
in general. In general, all organisms considered, the healthcare associated infections. So I appreciate that Klebsiella is very important, Pseudomonas, Clostridia, Candida, they're all very important pathogens. But just to put it in perspective to a casual observer of this field, to really drive home the point of how important this study is, what fraction of the infections that are acquired in the hospital do you think are contributed because of glove failure? It's principally the reason you started the study.
Okay, thanks. So you mean the many types of bacteria is important, but so in our studies, Acinetobacter is most highest risk, because you can see Klebsiella and E. coli and Pseudomonas is remain onto the glove, but very little amount or no transmitted. It's okay, and but wet surface is sometimes dangerous. But after dried, it's okay. But Acinetobacter remain, and same as resistant pathogen. So I think the Acinetobacter is, except Acinetobacter, is not so dangerous, but we have to care because it depends on the amount of bacteria. So we try to a little amount of bacteria, but high dose bacterial load is not, we don't have enough data. So it depends on the bacterial load and how dry, how wet. And okay, thanks.
Konnichiwa. Neil Osterweil from Medscape Medical News. Could you tell me what diseases A. baumannii can cause?
Okay, thanks. A good question. So Acinetobacter is always in the environment, especially in the water and wet samples, urine and sputum. And so important situation is ventilator-associated pneumonia, because Acinetobacter is less pathogenesis, and healthy patient is okay to suffer from the Acinetobacter, but immunocompromised and long care the patients about after the operation, and for the ventilator with severe respiratory failure. And so there are many data, severe Acinetobacter infection from the ventilator-associated pneumonia in ICU.
Arigatou gozaimasu.
Good morning. Michael Smith from MedPage Today. I have a couple of questions. One is, this was not a real-world study in the sense that you actually put the contaminants on the gloves. Okay. How do the loads of pathogens on the gloves compare to what would be seen if there was an accidental contamination?
Okay, you mean how to put on the glove and how to count the bacteria on the surface?
What are the counts on the back? What bacterial count did you put on the gloves? How does that count compare with what would be seen if there was just a mistake, if somebody got contaminated by mistake?
Okay, So we put on the gloves on the bacterial suspension and immediately put on the polypropylene surface and touch and swab the bacteria and the counted number of bacteria. It's a 0 second, so wet surface situation. And next, we wait for the 3 minutes after to dry the grab the surface. And after that, so we try to put on the put the grab on the surfaces and immediately swipe the bacteria and count the bacterial number. It's a dry condition, how many bacteria remained on the dry condition.
I'm looking for numbers.
Looking for the numbers, yeah.
What's the bacteria? For instance, you put E. coli on a glove.
Yeah, E. coli.
How much E. coli?
Okay. 10 to the 5 and 10 to the 3. So we show the data from 10 to the 5, and because 10 to the 3, a little amount of bacteria is not so calculated, and not very little amount of bacteria on the gloves, and no bacteria transmitted. Okay. So low dose of bacteria is okay, but high dose 10 to the 5 is dangerous to as show that.
Okay. Now, if I am a hospital worker and my glove becomes contaminated with one of these pathogens, how much pathogen would be on the glove in that case?
Okay, good comments, thank you. So we think how many bacteria is dangerous and as an infectious state. So in the sputa, 10 to the 5 per milliliter is infectious status. Yes, and in urine, 10 to the 7 per milliliter is infectious samples. So we try to 10 to the 5 bacterial load is similar to the urine and sputa samples. So, but already knows 10 to the 3 is not appears in the environment. I think 10 to the 5, 10 to the 7, over 10 to the 5 milliliter of the infectious sample is bad for us and easy to transfer.
I'll maybe come back to that because I'm still not clear that we're talking about the same thing. You say that in the conclusions, in your discussion, you say that, hang on, let me find the page. Improving glove use compliance will decrease the risk. What sorts of gloving errors would lead to a problem? What are people doing wrong with their gloves that would lead to this problem?
Yeah.
Okay, how about you?
例えばそうですね。Can you speak in Japanese?
Sure, okay.
例えばそのバルーンおしっこをカテーテルで出してバッグに溜めたものを処置して、それを看護師が手袋で触って、それを他のグローブをつけたままベッドレールとかそういうところを触るとそういうところにお湯についてしまうし、それが乾いた後にそのグラブをつけたまま他の処置をしてしまうとそこにもついてしまう。それが特にアシネトバクターの場合は問題になってしまうという。
Yes, he says like when using the urinary catheter for the patient, the nurses, the catheter.
I'm sorry, the
catheter of.
Catheter.
Yeah, catheter. Right. That's
okay.
Right. So then she or he treated some catheter for the patient, and then right after the treatment, when she touched to other surfaces in the environment, it's going to be contaminated. But even if in 3 minutes, still the microorganism remains on the gloves, then also it's contaminated to other surfaces.
Okay.
That's
Now
the
I
usual.
understand that.
It's
Could
the
I
usual
ask you
case.
to translate my question, my original question? I'm still trying to get a sense of,
Yes.
we now know how much bacteria the experimenters put on the gloves. I want to know, in the case of an accidental exposure,
Yeah?
how much bacteria would be expected to be found on the gloves?
So you,
On the bacteria.
yes,
Okay, good. How much survive on the gloves?
Yes.
Okay.
In an accidental exposure.
you mean a risky number of the,
Yeah, but not, I don't, I understand the risk level. I just want to know how the experiment compares to the real world. So the experimental number is 10 to the 5.
これは先生実験ですので、それが要するに本来だったらどれぐらいのそのリスク、どれぐらいの数だとリスクがあるのかということです。
Okay, I don't have enough data, and there are not so many data on the previous studies. So I can understand perfectly, but maybe 10 to the 3 to 5 is danger. But it depends on the situation. So some data from the broad pick up the bacteria in a broad area and swab in clinical settings. So nobody knows how many bacteria on the surface and the rear. I think it's infectious suspension is very, very dangerous for us, and 10 to the 5 is 10 to the 3 to 10 to the 5 is danger, but no data.
Okay. Thank you.
Thank you. Any questions?
Laura Beal from Science News Magazine. If it was already known that contaminated gloves are a problem, can you explain to me more specifically what this study adds to what we already knew about glove contamination?
I'm sorry, I can't hear that.
Yeah, could you repeat it again, please? Because we can't catch your voice
Oh,
clearly.
sure. This is not the first indication that contaminated gloves are a problem. So I'm not clear on how this study adds to what we already knew. Could you be more specific about the significance of this study compared to other studies of contaminated gloves?
Okay, what's new and what's different from the
Right.
other?
Yes.
Yeah, okay, thank you very much. So it's new. So we have various bacteria, but previous data is 1 or 2 bacteria competed on the same settings. But we try to ACE pathogen and compared to the compared and competed on the same settings. It's new data. So because some studies is bacterial load is very high, and some data is bacterial load very low, and we can't compare to E. coli. But our data sets the E. coli the setting, bacterial load setting, so we can compare to the which bacteria is easy to transmit. It's new data and not so many data in the this field. Next one is what is
So you're saying it's new because you looked at each individual species? Is that what's new about it? Is that you compared each one individually?
You mean eight species?
Yes.
Yes, right.
Okay.
And yeah, that is a point we did, because most of the research was conducted at the hospital settings.
Yes.
This study is very experimental, so that is different.
Okay. Thank you.
Any questions, comments? Thank you. It's all. It's okay. Okay.
Thank you very much.
Okay, thank you for coming today. So we enjoyed the discussion. I hope to share the knowledge. Thank you, and see you next Sunday evening. Okay, thanks.
Thank you.
Once you're in the BSL-4 space, the only way you can get out is to go through a chemical shower.
It's an unusual room, never seen anything like this.
Anybody who has access to this facility first has to go through an IR scan.
So the HEPA filters filter the air coming out of the facility, and that will remove bacteria, viruses, anything that might constitute any kind of risk, right?
Remember, this building is basically a second building inside the main building.